Michael Lepore here again today to talk to you about vein centers. And I think one of the most important differentiations I would like to make today for everybody about vein centers is they're not all created the same. It just kind of depends upon where you are, wherever it is in the country, and what your need is. With regards to Sarasota Vascular Specialists, one of the things that's different about us and our vein center, which by the way was the first certified vein center in the Tri-County area with regards to treatment of vein disease, we don't just treat veins. We actually are vascular surgeons who treat arterial disease as well, and abdominal aortic aneurysms, all different types of aneurysms as we've talked about before, as well as perform dialysis access. Oh, and yes, we also take care of vein disease. What are they? What actually are our vein centers? Well, really, it's any place that calls themselves a vein specialty location to be able to take care of patients who have venous disease. Could be varicose veins, spider veins. There is really a variety of different types of venous disease that can be treated at vein centers. Why would somebody want to go to a vein center? Well, simply because they've noticed that they've got something wrong with their legs that may involve the veins. It could be just simply that they have swelling or lower extremity edema of the limbs that's becoming incapacitating, needs to be further evaluated. Could be that they have large veins, which are the varicose, the big kind of ropey veins that you can see on patients' legs. Those are varicose veins, and they can become painful. Those are also the same people that are going to go to get treatment, and why they would need to go is to sometimes just feel better about themselves, and that's okay. If really from a cosmetic standpoint that you're really not happy with the appearance of the veins in the lower extremities. But I think one of the most important things to understand when you're making a choice about wherever it is you'd like to get your veins treated is you need to have some understanding about the difference between different places, the vein centers, and vascular surgeons in general with regards to vascular surgeons that run a vein center as well. Our training obviously involves many years of really dedicated attention to vein and artery treatment, not just the performance of a procedure such as an ablation or a microphlebectomy or spider vein treatment, whether it's through sclerotherapy or whether it's with lasers, but really understanding the underlying problems within the venous system that could cause some of these problems. Because if really you're with somebody who doesn't have those types of understanding with regards to venous disease, then it could be that some procedure is performed that may not help or even potentially make somebody worse with regards to their problems that they're experiencing. Again, the level of training at each center may be different. And I think as any patient seeking treatment, really you should want to take a moment and step back and just make sure that you're going to a place with somebody who's dedicated quite a bit of time to really taking care of venous disease in general, and can also take care of other types of disease and not just venous disease. So again, in summary, with regards to vein centers, I've said not all are created the same. I think it's very important that you have an understanding, no matter where you're going, what state you're in, no matter what city you're in, that you have a clear-cut understanding of the people that are really treating your venous disease, what their qualifications are with regards to treatment of the venous disease, and what other procedures they're performing at that particular location in order to take care of all of your needs. In my opinion, a board-trained vascular surgeon is really going to be the person who's spent quite a bit of time learning about all the different various underlying problems that could present with regards to venous disease and the treatment thereof. Michael Lepore with Sarasota Vascular Specialists on Whiteboard Wednesday. Thank you.